Hi, it's Dr. Lichten from Central Ohio Plastic Surgery, board certified plastic surgeon. Today I want to talk about Botox, but not Botox what you're probably traditionally used to, being up in the forehead, the glabella, or the crow's feet. But the newest indication for Botox is treatment of banding and neck. So those bands that you start to get when you grimace that tend to come out in patients when you're older and lose muscle tone a little bit here, or the muscle becomes a little hypertonic just from aging. It gives those sort of lines and wrinkles in there. So Botox is approved by the FDA for treatment of platysmal bands in the neck. And the same thing lasts like it does for the forehead or the eyes for somewhere in the 4 to 6 month range, most of the time re-injecting in 3 to 4 months. Now, the interesting thing we talk about is it's not just those bands that come out when you grimace or you say the letter E, leave those there, but Botox can also help rejuvenate the jawline and even up into the face. So the platysma muscle here that runs like a fan-like structure over your neck does a couple things. Now, one is those bands here, and we can treat those by relaxing that muscle. The second thing is that the muscles of your neck and the muscles of your face do have a little bit of a yin-yang kind of approach where these will kind of pull up a little bit, this will pull down a little bit. So by relaxing these muscles some can help create a little bit more rejuvenation up and through the cheeks. And the second piece is the muscle here, the platysma, actually comes up over the jawline here. So it does also pull down on the corner of the mouth so you can get a little relaxation there. But also if you've got a muscle that comes across the jawline itself and pulls tight, it will flatten this area a little bit. Now, in general, you're not really doing that too much of that muscle pulling, but if we relax it a little bit, allows that muscle tone just to loosen here, which can help the bone and see a little bit better definition of the jawline. So, in addition, you can go treat the bands of the neck, get better jawline definition, and the little lift just by doing a little Botox in your neck. Find out more about this and other things on our website at ohioplastic.com, or call the office, and we'll set you up for a time to come and get your neck evaluated and treated.